Hi everyone, I'm Dr. Rucha Bhave. I am a homeopathic practitioner in Los Angeles, California. Welcome to my channel. Today we are discussing why diagnosis is crucial in homeopathic practice. Now, it's a common misconception that diagnosis is not required for homeopathic treatment or homeopathic prescription. Now, although homeopathic remedies are prescribed on patient's constitution, tendencies, temperaments, and stuff like that, still diagnosis plays a very crucial role in selecting the homeopathic prescription or the dosage, potency, and everything. Let's just talk about 5 different elements that are responsible or make diagnosis as crucial part of homeopathic practice. So the very first one is prognosis of the disease. So what do we mean by prognosis? Prognosis is nothing but forecast of the disease. So emergency situations like acute attack of asthma, chronic kidney failure, heart attack, cardiac arrest, and stuff like that require hospitalization. Similarly, whenever patients are involved in accidents, or if patient has had multiple or compound fractures, then the only treatment is surgical intervention. So a skilled homeopath who is knowledgeable of clinical or medical symptoms of the disease is capable of directing his patient to appropriate treatment or care, and thereby preventing life-threatening situation for their patients. So that's why knowing diagnosis is very important in homeopathic practice. Now, second one is selection of appropriate homeopathic remedy. If a homeopath is aware of medical symptoms or clinical symptoms of a disease per se, then he or she, they can easily differentiate common symptoms of the disease from unique characteristic symptoms that point toward a specific homeopathic remedy required for prescription. So that's why, again, diagnosis or knowing symptoms of the disease plays important role in selection of homeopathic prescription. The third one is selection of potency. Now, this is a huge topic. It's called as Posology, which is science of dosage, and I have a separate video on that. I will post the link in the description below so that you can go ahead and just listen about it. But it in itself is a huge topic, depending on the damage to the tissues is done by the disease. Depending on that, potency is selected, and the frequency, repetition, is also another important part of homeopathic prescription. Okay, so like for example, heart disease, kidney disease is classified into 4 different stages. So it's really important to know how they are classified, what the symptoms are for each stage, and to what level is the pathological derangement that has occurred, and that everything decides the potency. Okay, so just go ahead and watch my video on posology regarding that. The fourth one is maintenance or managing the entire case as regards giving patient advice regarding diet, lifestyle changes, and overall exercise regimen and stuff like that. For this purposes, a homeopath should be well aware of what the clinical or medical symptoms of a disease are. Let's say, for example, a patient is diabetic or patient has chronic kidney disease, then if this patient keeps on eating things unchecked, and you're prescribing the medicine is correct, the potency is correct, the repetition is correct, but still the patient is not getting better. In such situations, the diet or exercise or lifestyle of this patient is obstacle to cure. Okay, so your treatment or the homeopathic medicine will work about 30 to 40%, and because of the diet the patient is eating, or because of lack of exercise this patient is uh, having, there is definitely obstacle to cure. And instead of your medicine giving results 80%, 70 to 80%, it's just yielding 30 to 40%. So that's why knowing about diet regimen, disease diagnosis is another important crucial part of homeopathic practice. The last one, the fifth element, is knowing whether your medicine is doing any good for the patient. Now, if a homeopathic physician or a homeopathic practitioner knows the regular course of the disease, the complications involved in the disease, then during follow-ups, the practitioner or the homeopath can easily be able to tell that whether or not patient is recovering from the disease or whether the disease is getting worse. So that's why knowing the course of disease, the complications involved in certain diagnosis or disease is really, again, crucial. So this is all about the topic, and to conclude, all I'd like to say is diagnosis is necessary for appropriate homeopathic remedy selection, appropriate potency selection, and appropriate advice on diet regimen and lifestyle changes. So this is all about the topic. Thank you so much for watching. You guys stay safe and healthy, and I will see you in my next video. Till then, you guys have a great weekend and upcoming week. Bye bye.